So good afternoon, everyone. Dear friends and colleagues, thank you for the invitation to be here today and for the opportunity to share with you many of the topics that I know have been discussed in this conference. A conference that for the last 25 years has really given the opportunity and provided the space for advocates, for scientists, professionals to share knowledge, to share expertise, and to bring everyone together. As many of you, I'm sure, know, I know cancer well from my personal experience. And as a Commissioner for Health and Food Safety, we have made Europe's Beating Cancer Plan one of our key priorities. When I say we, this is a plan that comes from the driving force of President von der Leyen, but from all the commissioners. In fact, to be able to deliver this plan, we were over 13 commissioners working on it. And it is a key pillar of the European Health Union. In the last 2 days, I have been in Italy. I have had the opportunity to visit the Bambino Gesù Children's Research Hospital, the Italian National Cancer Institute, and the European Institute of Oncology in Rome and Milan. And in the last 4.5 years, I have visited oncology centers and cancer hospitals in all the member states. And every time I go on a visit, I learn something new. I have listened, and I try to listen carefully to hundreds, if not thousands, of professionals and doctors and nurses and cancer patients and their families, because their experience never fails to motivate me. It never fails to teach me, and it never fails to make me even more determined to bring about change. And this is why Europe's Beating Cancer Plan and the work that we are doing to make it a reality are really very close to my heart. First of all, I want to share a little bit with you about what Europe's Beating Cancer Plan is about and what especially it does for breast cancer and for metastatic cancer. Our plan has 10 flagship initiatives. It has not a lot of actions, but I will try and focus on the 10 flagship initiatives. And through this plan, for the first time, addresses the whole disease pathway, from prevention to screening, early diagnosis, treatment, and quality of life to those affected by cancer. And many of its actions are relevant to breast cancer. In early detection, we have new EU breast cancer screening guidelines, and they are based on a Council recommendation which was adopted in 2022. This came to replace the Council recommendations that were 19 years old. Many, or some of us in this room, remember when the first screening recommendations were issued in 2003. And it was with, I must say, much surprise when I learned, when I became commissioner, that from 2003 we had not updated them. So they have now been updated in 2022. I think it was a historic moment for many of us. This Council recommendations take into account the new protocols, the new scientific evidence on screening. And the goal now is to offer breast, colorectal, and cervical cancer screening to 90% of all European Union eligible citizens. It highlights the need to follow European guidelines of quality assurance, because quality assurance is extremely important in screening programs. And for these guidelines to be developed, the European Commission initiative of breast cancer was fundamental. We also provided in these recommendations how screening guidelines can be adapted to local contexts. And we now have quality assurance schemes which define a common set of requirements for breast cancer services covering all the stages of care. It is, of course, voluntary, but services for breast cancer that wish to be certified need to follow the requirements on the scheme. We know that there is a big obstacle to more specific action on metastatic breast cancer. First of all, we have a lack of data. While we can track how cancer is diagnosed at metastatic stage, we do not have cancer registries in all member states that track the tumor progression and the transformation. We have also seen that there is a lack of standard definitions. And this picture means that we don't have a very clear situation of metastatic breast cancer across the EU. And this is a problem not only for the completeness of data, but also for designing targeted interventions, because we need to know what is happening on the ground in order to target interventions that will ultimately benefit patients to have the best outcomes. And on top of that, fragmented data and incomplete data often lead to missing conceptions and, of course, stigma about metastatic disease. Women living with metastatic breast cancer are often invisible. They are not part of the pink awareness campaigns, but they should be. Because a phrase I often say is that pink is not just a color, it is an attitude. And we need to put women living with metastatic breast cancer in the middle of our campaigns. We need to shine a light on them so that we understand that we need to do more for the quality of life, for the optimal treatment of these women. Because we know that women living with metastatic breast cancer today can live long and productive lives. So we need to listen, we need to support, and we need to speak out for optimal care. We need to act. We have put together a working group, a European working group of cancer registries. This is now being coordinated by the Commission's Joint Research Centre, and the group is looking at the definitions of cancer for recurrence, progression, and transformation, so that we can better understand what is happening in the European Union with the cancer registries. We can provide guidance to these registries in the form of a recommendation, in the form of having common definitions and variables for data collection. And in this sense, this will be key to identifying metastatic cancers. And I'm glad to announce that we're providing a joint action with member states in order to improve the quality of the cancer registry data, which will then go into the Central European Cancer Information System. And this is all happening through the program EU for Health, and it's ongoing, so I hope that member states will be able to address the issue of metastatic cancer through this action. The cancer plan has a number of other actions. We have a joint action on personalized medicine, and this can be used by member states to support activities for developing guidance for metastatic cancer, breast cancer patients, or provide specific education and training for health professionals and to help implement genetic testing. So I'm not going to take more of your time, but I want to share with you some thoughts. First of all, this is the first time that Europe has a cancer plan that is holistic, that is well-funded, and that addresses the whole disease pathway. This is the first time that this cancer plan has also been paired and twinned, in a sense, with the US and the Moonshot Cancer Plan. And why this is important is because we all need to work together to tackle cancer. Cancer cannot be tackled by each of us working separately. This is a cancer plan that has shown already through its 4 years that it is delivering, but it has also shown that we have huge inequalities across member states and within member states. And we need to tackle to solve these inequalities, because having inequalities in access to care in the area of health is not acceptable in the European Health Union that we are trying to build. And patients face inequalities across Europe, from screening to access to financial services to social discrimination, because sometimes of a lack of knowledge. So this is why we need to do much more. We need to speak out. We need to build up awareness. We need to invest in research and education. And because I know EBCC is very special, because advocates are here and they're equal partners in this, advocacy plays a key role in this. So metastatic breast cancer may, for some, seem invisible, but the women are not. The women, they have faces, they have names, and they have stories. And as Europe's Beating Cancer Plan, we're going to make everything in our power to make sure that these women are heard. Thank you.
Thank you very much, Stella, for this great introduction. So the focus of this year's manifesto is indeed metastatic breast cancer, because we felt that we need to give the voice to these women. We need to bring this problem in the spotlight. So I will start directly with the recommendations. There was a group of experts that have worked. 7 of them are here on the table. You're going to see the recommendations. I'm going to read one after the other. After each recommendation, there is one panel member that will provide few comments. Then you will vote. You also have the possibility to make comments so that we can change these recommendations or adapt them. There is also room for that, or improve them. And then there will be a final comment by the member of the panel, and then we'll move to the next recommendation. So I will start with the first one. So our first recommendation is increase the visibility of metastatic breast cancer to society and facilitate involvement of people with metastatic breast cancer in trials, the workplace, and most importantly, everyday life, as much as they want, and as much they are able. So I will turn to Fiorita for a comment.
Thank you. I think this is one of the most important recommendations. Living with the stigma of metastatic breast cancer is an extra burden to those already, to the burden that already have the medical issues. People with metastatic breast cancer are undercounted, undervalued, underrepresented. We want these people to be counted, seen, and treated properly. Metastatic breast cancer prevents the individuals from seeking advice and information, putting them and their family in a vicious cycle. The collective mentality now is that, as we heard from the commissioner, that it's all about pink, and the breast cancer is the good cancer. We have 95 overall survival, more than 10 years. This is not the case with metastatic breast cancer. Although difficult to treat, it's incurable, it's not a death sentence. The prognosis improved, we have a lot of many drugs, and these individuals should have the same opportunities and rights with everybody else. Policymakers should know and acknowledge this, and we must make sure that they should continue their important contribution to society, family, arts, science, and society. There are a lot of powerful campaigns that have initiated, and Europa Donna Metastatic Breast Cancer Currency campaign is one of them that was launched back in this year's October. And I'm sure you all came across these beautiful plinths around the exhibition halls with the banknotes telling the stories of 5 metastatic breast cancer patients in a very beautiful way. There are also a lot of other ongoing initiatives. The Lancet Commission, the Europe's Beating Cancer Plan, as we heard in detail, the ABC Global Alliance, and many more, striving to change this collective mentality and address the special needs that these patients have. Another very important issue is the return to work. Metastatic breast cancer patients, and all the patients of breast cancer, sometimes need or want to return to work because this gives them a sense of normality and purpose. Although it's difficult to cope with a rigid workplace environment, laws have to be implemented in order to protect these people and make them able to work as much as they want to. Discriminations regarding access to IC units and other medical discriminations should be addressed and implemented. Metastatic breast cancer patients deserve the best possible care regardless of their prognosis in order to enhance the survival outcomes and their quality of lives. Thank you.
Thank you, Fiorita. So now you can vote. Yes, no, abstain.
That's quite a success.
As you say, Fiorita, you rightly say so. It's the most important recommendation. So, we go to the second recommendation. Can we put the second recommendation? So the second recommendation is implement a national cancer registry recording stage at diagnosis and relapses in every European country, and share this data with the International Agency for Research on Cancer to understand how many people are living with metastatic breast cancer in Europe. So I would turn to Friederike.